Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about, is medical coding a money pit? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I got a comment. So I'm gonna read the comment and then we're gonna get into it. So here we go. All right, so the comment says, it seems like a money pit with all of the renewal of credentials as well as the membership renewal. As if the cost of the course and the exam isn't expensive enough. It's hard to secure an entry-level position with the apprenticeship. It really makes a beginner feel very discouraged and frustrated. That's why beginners feel intimidated and want to throw in the towel, but we must continue to thrive. That is an excellent attitude. All right, so here we go. Is medical coding a money pit? It can be. It can be, especially if you are buying everything that is put in front of you. Unfortunately, a lot of brand new medical coders, medical coding students get taken advantage of either by the school or somebody who is selling a program. I want everybody to look at this, all right? When you are brand new as a medical coder, and even if you have not sat for your certification yet, take the time to look at job listings. Are they asking for multiple credentials? No, that's number one. So all you need is one credential to start with. Now, I always recommend to brand new medical coders, if you're going to start out, spend the first 2 years with just one certification, because it is unnecessary to tack on additional credentials. Number one, it is not going to get you hired faster. Number two, you will not make more money because you have more credentials on your name, especially when you do not have experience to back up those credentials. It's very important that when you are adding on additional credentials, that you know what they are for, you've had experience to be able to back up those credentials, and you're actually going to do something productive with them. Because there are a lot of credentials out there that are vanity credentials. I call them vanity credentials, because meaning that everything about that credential can be wrapped up into one of the main credentials, right? So there's 4 main credentials, and all you need is one, okay? There is the CCS, that is the gold standard of medical coding credentials. And this says that you have mastered inpatient and outpatient coding. And yes, it is possible to study on your own and pass the CCS. It is also possible to go through a program and pass the CCS, but more on that later. There's a CCA, that is the Certified Coding Associate, and it is the entry-level certification. This is a very good credential because a CCA tests you on the most domains of all of the medical coding certifications. All right, so you have to know a lot in order to pass the certification exam. It gets a bad rap only because of the entry level that's in the credential description. But if people really understood what a CCA had to go through in order to get it, they would be they'd be singing a different tune, okay? So if you have this credential, that is great. The CCSP is the Certified Coding Specialist Physician-based, and that is the mastery of the outpatient setting. And that is a credential offered with the American Health Information Management Association. All 3 of these, the American Health Information Management Association. And then there's the CPC, that is a flagship medical coding certification for the American Academy of Professional Coders. Now, if you have no experience, they will tack on this apprentice designation to that CPC. All this says is that you have less than 2 years of experience, or you haven't met their time requirement yet for experience. That's all that means. And once you do meet that time requirement, it's 2 years of work experience, right? It's a couple of ways you can get rid of it. So there's the work experience where if you get hired on, right, or when you get hired on, you get your 2 years worth of experience. Then you can submit a letter and have the apprentice status removed because you've fulfilled the requirement to get that apprenticeship taken off, right? Or you can go through an approved AAPC program and you can complete Practicode. Practicode is another product. It's another more money out, but it's an educational product. It is 600 redacted, real world redacted medical records. I thought it was 660, but it may be just 600. I haven't looked at it lately. But once you complete all of those, and going through the course, completing the course, then they will take off the apprentice status. So sometimes when you're in school and you're doing all of this stuff, you can be done with it fairly quickly, and you will not have to have the apprentice status when you are out there. But it's more money that's going out for you to do Practicode. It's more money for you if you are just trying to hurry up and get this removed so that you can apply for jobs. You can still apply for jobs with the CPCA, and people will still get hired with the CPCA. And a lot of people will say, well, no, Blue, I've been looking for months. Well, here's the thing. If your resume is not reflecting all of your skills that you have learned, that's part of the problem. I see a lot of resumes that come to me with a lot of information that is missing. They're like, Blue, I just want a job. I understand that because I've been there, done that, right? But for those that come to me and I see them without their certification credentials on their name, right? That's part of your problem right there, because the employer is going to see hundreds of resumes, and they're going to look at these resumes, and if they don't see what they need to see immediately, like what certification do you have, if they don't see that right away, you're going to get passed over. So that's something, it's just about the detail, okay? And I do have my resume tip videos on my channel. So take the time to look through and check out those tip videos that I have for that. But again, if you are putting out money just because you think that having multiple credentials will get you more money or it will get you hired faster, that is simply not true. When employers are looking for a candidate in medical coding, they always say that they want 3 to 5 years experience. Always. A lot of them do. And they say this because they don't want to have to train. So what does that tell you? That they're looking for intelligence. That's what they're looking for. And you can have a lot of intelligence having only one certification. Because in my 14-year career now, I have met many people who have a string of credentials on their name and cannot code. And so again, if you are adding on additional credentials and you can't back up those credentials with the ability to be able to code, then you're just really spending money to support the association, right? Because you do have to have the membership. You do have to pay for your membership with AAPC. That is just a part of their business model, that they want you to pay your $190. That's the current cost for the membership every single year that you maintain your certification. So if you don't, they will revoke your certification. With AHIMA, they do not have this. They do have member prices and they do have a membership, but if you do not have the membership and you have your certification, you just pay a separate fee for being able to maintain your certification, because you do have to report continuing education units. Now, there are benefits to being a member of the organizations, either one of them, AHIMA or AAPC, because there's a lot of things that they provide. Sometimes they both do provide continuing education units. Not all of them, but they do provide some that is included with your membership fee. And of course, being able to do a lot of things like with their job board. You have access, if you're with AHIMA, you get access to their job board. Same thing with AAPC. And so there's a lot of things and benefits that you get from being a member. When you are in a technical field like we are, where we have to have this technical education, it takes money. It takes money to get in, and it takes money to stay in, because the field has to continue to grow. And the field also has responsibilities. Both organizations have their responsibilities. AHIMA, for their part, they do a lot of work with the laws and things like that. So they have to be up there on Capitol Hill and things. So there's a lot of things that go into these organizations. It's not just, I'm just paying all this money for my membership. Those membership fees go to the cause, all right? And plus, both AHIMA and AAPC are both for-profit organizations. There's that. So it is a business thing. But I always tell my brand new people, don't be taken advantage of by these people that are trying to sell programs and say, oh yes, you need to have multiple credentials, or yes, you need to buy this course, or you need to buy this or buy that. All you need is your certification. That's it. And then you can go out into the real world and start applying. But how do you continue to learn, right? If there's all these programs and you think that you need to buy these programs or these exam prep programs. I'm getting complaints from people talking about the different programs that they're going to for exam prep, and it's not what they thought and that kind of thing. I have nothing to do with those. But what I will say is this: I have given you guys many times on my channel ways to save money when you are trying to prepare for these exams, and to buy older books that are maybe 1 or 2 years old, as far as like the workbooks go, because they have the same exact questions as the current year. The only difference is if there's been an update to a code that may look different, but you can tell from the answer key versus your current book. If you're using like 2022 and you're using a 2019 or a 2020 workbook and the code doesn't match and you can't find that code in the book, then you know that code got updated. And it's very easy to just do a Google search to see what did that code update to, or why was it deleted, or whatever the case may be. So that way you can find your answers. It's not about having to spend money every single year on all the books and doing all these things. And people will, that's another complaint I get. Well, I don't want to have to buy books every year. Well, sometimes the employer will buy them for you. So that is a perk of a lot of employers. Some don't offer that though. And if yours does not offer that, there's plenty of places where you can buy like really good books for cheap. I always talk about Optum 360 coding. Not an ad for Optum. But I will say that they always have sales on their website. Always. They will have sales for the current year books, and then they will have sales for the next year books. So it's really, it all depends on what time of year you look on the website. But when you go there and you go to best deals, then you're able to find books cheap, right? And so I've been able to find my 2022 books for like $20. So that's something that, you know, if you're interested in getting a set of books for yourself, look on Optum 360 Coding, and that way you'll be able to find deals for the books that you need. Because again, you don't have to spend a lot of money to be able to do studies. And for those that say, well, you know, I have to go on Amazon and buy all of these things for anatomy and things like that, you can always go on YouTube and research all of the free videos that are out there. You know, YouTube content creators spend our time to make these videos, and all you have to do is watch. And yeah, you might have to sit through an ad or two, but really at the end of the day, how inconvenient is that for you? It's just a couple of seconds. It's just a few seconds. It's not even that long. And you can always skip the ads. That's totally fine. Or you can buy that one thing, the membership, where you don't have to sit through ads at all, you know, if they're really that bothersome to you. But think about this, you know, people take the time to make these videos for you, to help you. And so, I mean, it really all depends on where you go. But you can find plenty of them that talk about anatomy and medical terminology, and even for the surgeries, and even for HIPAA and all the breakdown of that. There's tons of ways of getting that information. You can also visit CMS, and CMS has a Medicare Learning Network, and that has a lot of downloadable free booklets that explain to you a lot of the things like the global surgical package, right? And what is included in a 0-day, 10-day, 90-day global period. And so it's just broken down. It's a wonderful booklet that you can download from there. Go to CMS and find the Medicare Learning Network, or Google the Medicare Learning Network, and it will come up, okay? So that's something that you need to really start to be resourceful, because it can get expensive if you have things put in front of you and you buy everything thinking that you need it, but you really don't. Okay, so, and then again, if you follow my rules, my advice, not rules, but advice about buying books that are cheaper, so that way you can practice on those and learn from them, you know, it's all the more better. Sometimes people will say, well, Blue, I want like big op notes to work with, but then they can't find simple diagnoses or even complex diagnoses in their book. So if you can't find the diagnoses in the book, you can't look up procedures, you know, by themselves, what makes you think that you can actually look at big op notes and not be overwhelmed, because you don't really understand just the basic part of it. So that's why I say, like even with this challenge, this ICD-10-CM coding guidelines challenge that I issued to everybody on October the 1st, the challenge is to read through the coding guidelines 4 times. And I've had people write to me and tell me that they dropped out because they couldn't do it. They missed a couple of days of reading and they just gave it up. Okay, well, think about this. We read all day. Reading is very imperative to what we do. And if you want to get really good at medical coding, the free part of it is your practice time. That is literally a big part of it. You can't buy efficiency in these books. You cannot. As far as like being able to look through them quickly and knowing where to go in the books, you can't buy that. And I think that that's what happens with a lot of people, is that they think, well, if I buy this course, if I buy this course, if I buy this exam prep, then, you know, I'll be absolved and I'll be ready. No, it takes you to actually do the hard work. And you can't buy that. There's a lot of people that try to buy their way out of, you know, failing tests again and again, and they don't understand why they're failing. Just taking the time to practice, and you can do that for free on your own. That's not something that you have to pay somebody to do, right? Because everybody has their own products and everybody has their own services, right? And so if you are not fully exercising your ability to be able to go through these books, that's part of the problem. And again, you can't buy your way out of that. All right. So I tell people to save your money, especially to my brand new people. Save your money. Get only one certification, no matter how much peer pressure you get, no matter how much they say, oh yeah, well, you make more money. No, you won't. No, you won't. What will give you more money and make you more money in the long run is experience and time. That is what will give you, that is what will make you more money. People who are very experienced, who have like degrees and things like that, that's the thing where they're starting to look at more experience. That person's more experienced. And medical coders start off at a really good rate anyway, a really good salary rate. And you can look at the Department of Labor or the Bureau of Statistics and be able to figure that out. Because every state is different. That's why I never give specific dollar amounts on my channel. There's other people who are out there selling that, and that's how they're drawing people in. I don't have to draw people in. My channel is for the serious medical coder who wants to get into a field that it's going to challenge them, you know, intellectually. It's going to give them that motivation to keep going in their career. That's what my channel is for. So when it comes to having to pay out all these things and complaining about the cost of the memberships and things like that, that's all part of doing business. All right. And if you're with AAPC, that is just a fact of life for you. But again, all you need is one. You don't need multiple credentials. And the time that I tell people to get multiple credentials, if you need to or if you want to, is later on in your career. Because a lot of times people will start their career with a CPCA, right? And then they want to tack on a bunch of credentials because they see their peers with a bunch of credentials. And they think that they need to compete with them. Don't start competing with other people, guys. This field is competitive enough for yourself on your own. Don't be worried about what Sue, Jane, and Sally are doing. You need to focus on yourself and get with these books. That's what you need to get with. Because I've ran circles around people only having one certification. I had the CCA for 13 years, and I ran circles around people with multiple credentials, with degrees, who are nurses and all that kind of stuff. And I was able to train doctors. I was able to train other medical coders, and I was able to train leadership. So if I was able to do that with only one certification, and I've done very well, guys, come on. So again, spending all this money because you want to have a bunch of letters after your name, it makes no sense. It makes absolutely no sense. And again, the more money you spend out, the more the associations make. And not that I'm trying to like make the associations less money, but I think that there's a responsibility on the coder to responsibly add additional credentials over time, but not in the beginning when you're brand new. All right. So again, don't feel forced to hurry up and move the apprentice status. Remove that. Don't feel forced to do that because people are going to hire you anyway. And even if you have the apprentice status off of your credential, you still don't have 2 years of experience. You still don't have any experience if you haven't been working, right? So again, why did you just pay all that extra money out? because you think it's going to get you hired faster just because you have the CPC versus a CPCA. Either one of them can get hired, guys, either one of them. And I've seen people who have the CPC who still can't get hired because either their resume is the issue or they're not applying at enough places. And not only that, when you get stuck at entry level, I need to apply for entry level, and that's where you have those blinders on. Again, you're wasting time. And it's a waste of money too, because when you sit there and you only look for entry level positions, they're not going to be out there as much as, hey, we have a medical coding position. So apply for all of these things, because remember, the clock is ticking and you have 2 years to report your CEUs, right? And so if the faster you can get in with an employer who offers CEUs as a condition of employment, the better, right? But if you're going to sit there and spin your wheels and only look for entry-level positions because that's all you think you deserve, you're going to be waiting a long time, and you're going to be in a long line of people who are singing that same chorus. Oh, I couldn't get into medical coding. It's too hard. It's too hard. It's not impossible. Is it difficult? Yes. Will it make you fight for it? Abso-freaking-lutely. But as I have already suggested on my channel many times, go to the temp agency. That temp agency is meant to get you a job because they are another person trying to help you get work. Isn't that better than just you being the only one out there looking for a job? You got the temp agency also on your side. Now, they're not going to give you all these benefits and everything that you think that you're going to get, right? Or that you want to get getting out of the gate. But the time that you spend with those assignments is meant to get you filler for your resume so that when you're applying out there, now you have something to have on your resume. And by the way, one thing before I wrap it up, Practicode is not work experience. I hear that so much. Oh, I'm going to write that down as experience. No, ma'am, no, sir. Everybody knows what Practicode is. It is an educational product. And while some employers will take education in lieu of experience, you trying to say out there that, oh yeah, I did an internship and this is what I did, or this is my work experience, guys, they're going to know. They're going to know right away. All right. So while it can be a good product, that Practicode, working with the workbooks is just as good. It is just as good. All right. That's just my advice anyway. So love it or leave it. So anyway, but that's my advice there. If you are in school, you do not have to worry about getting those medical terminology books, medical terminology for medical coders, because again, that's another sales tactic, and that's a gimmick, because those medical terminology books are a dime a dozen. And then if you slap the name medical coder on there, now you have a captive audience, and now everybody thinks that they need to have that book. No, you don't. We all use the same medical terminology. So that's why, guys, don't waste your money on that. You can totally go to the internet and you could totally find resources there. You could totally look at YouTube and find those resources as well. And if you ask me, I will tell you to look it up, because that is what we do. We have to do our research. And I've left the links many times. So take a look back through my videos, look through the description boxes, and you'll see all the books that I do recommend. I'm just saying. So I'm going to wrap this one up. Thank you guys so much for joining me, and keep your money in your pocket and spend wisely. That's just all my advice anyway. So I will see you guys next time. Have a great weekend, everybody. Bye.